Let's learn about the posterior compartment of the leg. The posterior compartment of the leg is also called as the calf. Posterior compartment of the leg is limited superficially by the deep fascia of the leg. On the deeper aspect, it is limited by the posterior surface of the tibia and fibula, which are connected by the interosseous membrane, and then we have the posterior intermuscular septum. This is regarding the boundaries. What about the contents? The contents of the posterior compartment of the leg include superficial muscles like gastrocnemius and plantaris and soleus. Soleus is seen on a much deeper plane. Then in a much deeper plane we have tibialis posterior, flexor digitorum longus, flexor hallucis longus and popliteus muscles. Apart from this, we will have the tibial nerve, posterior tibial artery and cutaneous structures like the sural nerve and small saphenous vein. Now let us try and learn about these structures. Of course, the cutaneous structure we have the first structure, the saphenous vein. The saphenous vein begins from the lateral end of the dorsal venous arch, ascends laterally along the lateral border of the dorsum, runs behind the lateral malleolus, ascends upwards on the middle of the back of the leg before it terminates into the popliteal vein. But in this cadaver, this is progressing much more beyond the popliteal vein. This is regarding small saphenous vein. Small saphenous vein is always accompanied by this thick cutaneous nerve. And what is this nerve? This is the sural nerve. The sural nerve pierces the deep fascia of the leg almost in the middle, and this comes as a branch from the tibial nerve, the tibial component of sciatic nerve. So this is the sural nerve. Let us talk about the muscles now. The muscles of the superficial plane begin with the gastrocnemius muscle. The gastrocnemius muscle arises by two heads, the medial head and the lateral head. The lateral head takes its origin from the lateral condyle of the femur. The medial head takes its origin from the posterior surface of the medial condyle of the femur and the popliteal surface of the femur which lies above this. What about the insertion? The insertion is into the tendocalcaneus. If you observe, this is the tendocalcaneus, also called as the Achilles tendon. This is formed by the fusion of the two heads of the gastrocnemius along with the soleus muscle which lies deep to it. The tendocalcaneus ultimately gets inserted to the posterior part of the heel or the calcaneum. The nerve supply to both the heads is from tibial nerve. The actions of the muscle is combined with the action of the soleus, and they are powerful plantar flexors of the foot. This is regarding the gastrocnemius, and once we cut the gastrocnemius, we will identify the soleus muscle and the other deep muscles. One more important muscle we need to know here is, let us try to rotate this a bit. Can you identify this? This is the tendon of plantaris, also called as the freshman's nerve. The plantaris muscle takes its origin from the lateral supracondylar ridge of the femur, descends under the cover of the lateral head of the gastrocnemius, and then ultimately fuses again with the triceps surae or the tendocalcaneus, inserted to the back of the calcaneum or posterior surface of the calcaneum. A weak plantar flexor alone itself cannot bring about plantar flexion, but acting together with tendocalcaneus, it can bring about the plantar flexion. This is regarding the two superficial muscles present in the back of the leg. Once we cut the gastrocnemius, we will identify the next muscle, that is soleus.